Oh.
Ooh.
See? That wasn't anyone here. This linen comes from the linen people. Okay, so we have that. So now if they had a sheet on top of them, we would just kind of reach under and we would grab that sheet, bring it down and kind of fold it into itself and put it in the linen, okay? But now we're gonna take the gown off.
Hold on, we're tied here.
She's not breathing.
There we go. Oh, we'll keep you covered here.
So we're just kind of rolling this dirty gown down.
Yep.
So we can kind of keep it, all the inside part to the inside, or whatever you want to say. And this is my linen.
How about that sheet that was underneath the patient? Do you take that, like the turning sheet or pad?
We're gonna get that after we clean them,
Oh.
unless it's dirty ahead of time.
Yeah.
Yep.
Okay.
Yep. Okay. All right. So again, we're just gonna kind of move a little quickly for purposes here. You want to always offer. Do you want any of this soap used on your face or not? If they don't, you will have just a plain warm washcloth. I know our checklist, and probably ATI still says about a mitt. We do want you to practice one time with the mitt today. You can use it all the time if you would like, but you do not have to, okay? But with the mitt, you're gonna you kind of divide that washcloth into thirds and you kind of go in the middle, and then you're gonna pull one of the thirds over and the other third over, so it kind of folds on itself, and then you can tuck it right in and you have a nice little mitt, okay? So I'm gonna clean the inner to the outer canthus. So we're gonna reach another spot. So if I did it like this, I'm just gonna go like this, okay? And there'd be a lot of drainage. I'm gonna get a new washcloth. Otherwise, I'm just gonna kind of move the position. And you can just hold your washcloth however you want, okay? We just want you to practice with the mitt because it's fun. So then I'm just gonna clean the rest of the patient's face. Just so you know, this mannequin kind of gets, all the fuzz sticks to her skin. So I'm just see how I keep moving to different spots on the washcloth. I get her ears. We can get the back of her head with help from my partner, okay, around her neck. And then I would toss this in the linen and get a new washcloth, okay? All right. So, we're gonna do her chest first. So what you would want to do is you would want to put a towel over your patient and then just kind of pull this down part way. But we're gonna actually take it off so you can see what we're doing, okay? But normally,
Being you want to keep them as covered as possible.
it's a little flappy. Okay. All right. Sorry, Annie. All right. Okie doke. So I have one spot and I'm just gonna clean all across the chest area, down on the sides. See how I'm moving my washcloth around, down on the sides. And
Making sure
Less-
you're getting under the chest very well.
Yep. So a female, I'm just gonna displace your breast tissue so I can clean. You're gonna be looking for redness, moisture, all those types of things. And see how I'm just moving my washcloth all along, okay?
So we're supposed to keep that towel over them though?
In real life, yeah.
Keep them as covered
So-
as you
so you
can,
have
like
them
one
covered.
area at a time.
And then you kind of would, kind of
Oh.
go like this.
Okay.
We're just keeping it undone. Yeah, thank you. Yeah. Okay. So we got that. Toss that. Get another.
How
So-
often are glove changes?
Anytime you're in a soiled area, you would.
Okay.
So
or if you're
there had-
concerned, you can
Right.
swap them out.
there had been drainage or redness or moisture, you definitely would want to do that. So we'll just kind of put this here so you guys can see, but we would have the patient covered as much as possible. And do your abdomen. We're gonna get their umbilicus area very good, okay? Any folds that have in the abdomen, you're gonna displace those. You're going to clean under there, looking at the skin for moisture, redness, etc. Breakdown, okay? And again, we're not getting the patient really wet because these are not soaked. So we're gonna let them dry naturally unless we need to dry them because of something with them, okay? That's that one. All right, so let's cover her back up. And now we're gonna do arm. Oh, I can't remember where I start on the arm.
Oh, the shoulder area?
Excellent.
Thank you. Why do we start at the fingertips and not the underarm?
This is the.
Yeah.
Most likely more dirty than your hands.
Yep.
Yeah.
Okay, so we're gonna start fingers, fingernails, get between the fingers, the best you can. This hand we can do pretty good. So I'm coming up towards the wrist. I'm gonna change spots as I need to. And I'm gonna take a peek at my elbow. If something's really dirty, I'll grab a new washcloth. And then now I'm gonna go up towards the axilla. And if I need a new one, if not, I get a new spot. And I'm gonna clean under the axilla really good, okay? And then as long as the patient's not opposed, we do have some kinds of deodorant, but a lot of people have their own, so it's always a good idea to put deodorant on if they're okay with it, okay? Now, if we would need to, we can dry them for any reason, and if not, then we will go to the other side, and your other person will do that side, or if you're alone, you'll put that rail up, walk around, and do that other side.
And we do want to encourage them to do as much as they can if they are able to.
Definitely. Oh, that tickles.
When we go for clinicals, you guys said we're gonna be doing this a lot, right?
Yep.
Are
Every
we,
time.
most of the time it'll be like with some of the other people, or we'll be on our own?
If you're able to do it by yourself, your patient's able to help you somewhat, and you feel like you can get the whole thing done safely by yourself, then you're fine. If your patient's bed rest and they don't move very well, then maybe grab another student to go with you. If no one's available, grab an instructor to go with you, but don't try to do anything that
Right.
is too much.
Unsafe
by
for you
yourself.
or the patient.
Yeah.
So how would we like ask or suggest like the patient does it them, like does a part of it themselves with
We'll
their
tell you in
capable
just a
of?
minute when we get there to that one spot.
Okay.
We'll role play that, okay?
Yeah.
Sound good? Okay. All right, so now, we'll do the same. Oh, she hurt my arm. Oh my goodness.
Okay.
We'll do the same with the leg. Oh man, I can't remember where we start on the leg. Do you remember?
I would say
Probably the same.
Top
Yeah.
to the bottom.
well, clean us the dirtiest.
Just
What do you think? You people have your checklists open.
Side to toe.
Your upper 5 feet.
Wash leg
Okay.
from ankle to knee and knee to groin.
Okay, so we're gonna go ankle up to the knee, and if we're kind of gently rubbing this way, because this is the way why are we doing that?
Because that can help with blood flow.
Yeah, that venous return, beautiful. I'm gonna take a peek at that heel while I'm there, okay? And another spot,
Are you also like checking vitals or edema, what other stuff while you're doing it?
you
Not
would have
really.
already checked that stuff and
Okay.
made sure they're okay.
Okay.
Yeah. So we're just, you know, this would be after you do your vitals, your head to toe, after they eat breakfast, something like that.
Okay.
Yeah. Okay, so I'm checking, I'm taking a peek here. My groin, okay? And I'll probably need to get a new washcloth after that, and then I'm gonna do my feet, right? Okay, so we need to get between each toe. Okay, very gently. We're really taking a good look, another good look at that ankle, and making sure everything looks nice and good and intact, okay?
Forgot some toes though.
Well, I know, but I'm trying to go quickly, okay? And and then we would do the same on the other side.
With
Okay.
the same washcloth?
No, you'll get a different
And
washcloth per
Okay,
case.
so we're using like 10
Probably.
wash rags.
8 to 10.
And it's gonna depend on how dirty they are as well, so.
Okay, so now we're gonna go, let's do the back, okay, alright. So again, we're gonna see if that patient can help us. Don't forget about your draw
Come on,
sheets.
Annie.
I'm helping.
I have a question that might be stupid. If before they're wearing the yellow socks,
Uh-huh.
after you like wash their feet and everything, would you get new socks or would you just use the same one?
You use the same ones unless they're really soiled.
Okay.
Yeah, good question. Alright, so I'm just gonna clean your back here, so I'm just gonna go down the back. And another spot. I'm gonna clean the buttocks, all the folds. If I need a new one, I will. If not, go to a clean spot. And I'm gonna wash, which way?
Front to back.
Front to back, okay? So always front towards the anus or the rectum. Why are we doing that?
Cleaner to dirtier.
Cleaner to dirty, right? We do not want to get any stool at all into the urethra, or we could cause a urinary tract infection. Okay? Sometimes you may want to have your towel and just pat dry a little bit here. Toss that one. We can put some lotion on the back if the patient is not opposed to that. Okay? All right, so
Back on your back.
now, are you able to do your private area yourself, or do you need help?
I need help.
Okay, that's really how you can ask.
You get it, honey. That's what they'll say.
You
Because
get it.
we do want to promote, like Heather already said, we want to promote their independence.
And
if
sometimes
at all
you can
possible.
kind of get an idea when you're starting at the face. You want to go ahead and clean your face. You want to clean your arms.
Okay, so this is what's gonna be important for you guys to know now, okay? Is this gonna carry over for when you do Foley's. So for a female, what you're gonna do is you are gonna hold the labia apart, and Annie's kind of firm, okay? You're gonna go, it's cause she's new, she hasn't been used a lot. You're gonna take one, you're gonna go from top to bottom on one side, and you're kind of getting in the folds. You're gonna grab a new spot on your washcloth, you're keeping it open, and you're gonna go down the other side. And then third area, and you're gonna go straight down the middle, okay? So the important thing is keeping that spread apart so that you're really getting perineal care done very good, okay?
I know that's uncomfortable. We just got to get you real
Yeah.
clean here.
Yes. Now, if we have a male, okay,
Oh, hello.
hello. You're gonna grab a washcloth. Improvise with what we have right at the moment. So you're gonna hold the penis upright, okay? And you're gonna start with a spot, and you're gonna go from the middle opening, and you're gonna kind of go out, okay? And down the shaft. You're gonna do that 3 different times, okay? 3 different spots on that washcloth. And your third. Now, if a male is not circumcised, this one we would consider circumcised. They have all that extra foreskin. You would pull the foreskin back, and then you would do all this care. That when you're done, you pull it back over, because you do not ever want to leave the foreskin down here. It can and will swell, and you don't want to be the one who's done that. Okay, we'll leave it at that for the moment. All right. Okay. All right. So we're done now. We'll grab that washcloth out, toss that in the linen, change our gloves, and now we're gonna change this bed. Okay. All right. So
So Would you have done his scrotum during that period of time?
Oh, yeah,
Obviously.
yeah,
Okay.
yep, thank you. Forgot. Yes, definitely. After you did. Yep. Okay, so what we're gonna do now is we are gonna change the bed. I'm sweating like a pig. We're gonna, yeah,
Just
yeah.
all four or yours?
Both, yeah, on both sides. We're gonna loosen all this linen, okay? We wanna make it as easy as possible for us and our patient. So I'm gonna have my new linen all out and ready to go before we even turn the patient over, okay?
This you want someone with you for sure to do. You don't wanna do this by yourself.
They're not always folded perfect, so.
How
In a
often do
perfect
you change the linens?
So if they're soiled, you're definitely gonna change them. And then currently, what are they saying?
I think it's every couple days.
Usually at least the pad, I think, every day, pillowcase, and
Gown.
and gown. Sheets are just gonna kinda depend upon the situation.
I'll
But
be
I think you,
honest.
at home, you don't change your sheets
No.
every day either.
But
Would you,
most people are gonna change in the hospital, in all honesty.
if someone were to use like the bathroom on the bedpan and they didn't soil the sheets, like, or they did soil the sheets, you would do this step of the process before giving them a bath?
Yeah, you kinda do
Obviously.
it all at the same time.
Yeah. Yeah,
'Cause-
and we could have done that when we're doing the back, we could have been doing the new linen.
Yeah,
We
okay.
just wanted to show you separate,
Mhm.
but yeah,
Yeah, if
yeah,
they're full of stool, your bath is gonna look a little different, and maybe you're
Yeah.
gonna start with that area, clean your hands, change things, and
Yeah, I
kind of.
think you have the wrong end on that one.
yeah, I know, I'm
Oh,
trying to
okay.
see, I wanted to see sometimes,
Like she's not gonna have anything to
sometimes
grab.
they'll say, I wanted to see if this one did, sometimes it'll say this side down or this side up, so.
Oh, no, I-
No, yeah,
your
that.
sheet.
Yeah.
Oh,
yeah.
my sheet, oh,
Yeah.
I'm sorry. I thought I was-
Heather doesn't have anything to grab.
Oh, thanks.
She's trying to stay
Good
out.
job.
How challenging she could make it for me.
I was looking at the bed, it doesn't say
As
that.
you can see, baby's getting everything ready, because once we get this patient on their side, they're not gonna wanna stay there for very long, and I'm not gonna wanna hold them there for a long time. It gets hot, you start sweating.
Which I am doing right now. Okay,
So getting the sheet there, she's got her pad rolled, so
so
that way
I'm
we're
gonna
ready.
show you where you wanna put this pad.
Come on, Annie, we're coming on over here
Here you
again.
go. Okay, so I'm going to try to keep my clean stuff from the dirty. So I'm gonna push this through as far as I can. Anyone who wants to come over can see. So her butt is right here, okay? So I'm thinking I have this divided into thirds, which actually on this one you can see. So I basically want this top third to be her buttocks and up. Cause I want all this down here so that we have room to be able to pull her up a few times, okay? So I have it rolled up, I'm gonna roll it under this. If this is soiled, I'd put a towel or something there.
I was gonna say, you might be giving a little too much. So tucking it as far as you can over that way is very helpful. Especially if they can only lay on one side.
And then I'm gonna grab this old stuff.
I got you here.
And again, if there was anything soiled, I would definitely have a towel in there. Or I would have rolled it first. I'm not being very successful with this.
Nope, that looks good.
All right, so you're gonna let the patient know. They
There
have a
we
bump to
go.
roll over,
Big old bump.
and
So by keeping that rail up, it makes them
Run
feel
over,
more
Annie.
secure as well.
Yeah.
yes.
Otherwise they think they're gonna fall on the floor. So
she's
she had
gonna-
that rolled perfectly that I'm able to, if there's anything in there I'm worried about making a mess, I'm just gonna make sure we roll that up as well into a nice little ball and put in your linen, dirty linen. And then look at how perfect this is. This is only gonna take me a quick second because she did such a nice job making sure that it was pushed through and positioned well. If it's not, you may just have to roll back an extra time. So you wanna make sure no wrinkles underneath there, because why?
Pressures.
Pressure injury, yep.
Yep.
And it'll be creases on their skin.
So So we'll let the patient know to come back, and then I was a little overzealous in pushing that through, so she gave me a little extra.
Back a little bit
So,
here, Annie.
Gonna pull,
There we go.
pull that over, okay? All right. We're going to put the gown on. Again, if we're soiled, we're gonna change our hands, our gloves. So as far as these go, the snaps, there is one easy way to do this. So, yeah.
Oh, I didn't know if you
No,
wanted
I'm
it.
sorry. So if you find this stitching hem stuff in the middle there, okay, and you want to find the next set of that hem stuff so it lines right up. So-
Everyone needs to practice this when you
Yes,
guys get to
definitely.
it, because you're gonna get in with the patient and you're gonna be
Yep.
so lost.
So if you do it like this before you even start, then you're gonna know, oh, I got it right, okay? Because this all should line up. And you can, if you have a patient who has an IV or anything on their arm, then you're gonna wanna put it on them before you snap, okay? So these are made like for people with IVs and different things, so. All right, so we're just gonna put this on. And then,
And then kind of like what I did with the other gowns, what I like to do is to tie in front and then you can slide it over their head. That's just a personal thing that I kind of do.
I don't trust myself to do that, cause I think I'll give them whiplash, so, but, what, yeah. So, whatever works for you guys.
All fresh and clean.
Now I'm folding this, even though it's stuck on her, I'm folding this outside in, putting in the linen, and we're gonna put this is where the fun begins. Anybody military in here, Kayla?
Yeah.
Yeah, okay. Alright, so we want this to go halfway across the patient here. So want enough up here, wanna make sure we're kinda half and half, how much you got on there? About that?
Yeah, we're probably close.
Okay, alright. Nick can't do these, please say something to him about that, okay? Alright, so we're gonna do a modified mitered corner. So first what we're gonna do, we wanna leave a little room for our patient's toes, okay? So we're going to lift up, and then we're gonna bring this under here, okay? So the bottom of the mattress, okay? And then you're gonna come up about a foot, alright? And you're gonna bring this up, and you're going to kind of make it into a nice little triangle here, right? Even though mine's not looking nice. And then you're gonna tuck this part down in. And then you bring that down. It should look more beautiful on there. Okay, so that's a modified mitered corner. Now, what would the military do, Kayla? Remember?
No.
They would do a full mitered corner. They'd tuck all this under, and this poor person would be like
Tight.
in a tight, in a,
In a pitch.
yeah, in a.
Oh, no.
Okay? Alright, so that's what you're gonna do. We're not gonna use the blankets today, cause,
She's good.
and then if you do the pillowcase, you would wanna take that out from under someone's head, lay their head down gently, and then you're gonna kinda hold it from this end, you're gonna pull that pillowcase back on itself, okay? And then you would be pulling it off. You would wanna clean anything that's soiled, and then we're gonna say this is a new one. So I'm gonna grab it, I'm gonna go to the open area, gather that. Okay, and then I'm gonna grab, tag in, that'll drive me nuts too. And grab the end of it where I had it all gathered, and then I'm just pulling it over, and there I go, okay? go, Annie. Now we're gonna refold the laundry and reuse it all week, and then we'll get rid of it. So, cause it costs a lot for the linen to have to be washed, and we don't need that, so. Alrighty, there we go.
Woo!